Hi, everyone. My name is Vinay Chandrasekhara. I'm an associate professor of medicine at Mayo Clinic in Rochester, Minnesota, as well as the director of the Pancreas Group and the head of the Advanced Endoscopy Fellowship. And I'm here to discuss our paper that has been accepted to GIE, entitled Identification of Patients with Malignant Biliary Strictures Using a Cholangioscopy-Based Deep Learning Artificial Intelligence. Identification of malignant biliary strictures still remains to be a big challenge for us. In surgical series, up to 24% of surgeries performed for hilar malignancies were ultimately found to have benign pathology. And this is partly because that most tissue sampling for malignant biliary strictures is performed via ERCP with brushings for cytology, which can have a very low diagnostic accuracy. Diagnostic sensitivity can be as low as 15 to 20% when you're just looking at patients with malignancy called on a cytology brush. That number does go higher when you include suspicious for cytology, or you include other testing modalities such as FISH, fluorescent in situ hybridization, which can bring the diagnostic sensitivity up to about 50%. Therefore, there's a need to better evaluate strictures for malignancy, especially those that have a higher likelihood of malignancy, as we want to diagnose patients early so that they can have the best outcomes. Now, EUS and FNA have definitely improved diagnostic sensitivity with endoscopy, especially for distant malignant biliary strictures or pancreatic head masses. However, there is caution when using EUS for sampling hilar malignancies, particularly cholangiocarcinoma, due to the concern for needle track seeding, where you may disperse the cancer cells into the duodenal wall, which then would not be treated with any sort of liver resection or a liver transplant. Now, cholangioscopy has been utilized and has had reportedly the highest diagnostic sensitivity for detecting malignancy. However, this is based on a visual diagnosis. Sampling with cholangioscopy still remains subpar, even with biopsies, and also with a new generation of cholangioscopy-directed forceps, the overall sensitivity still remains low. And what we've seen is that if a visual diagnosis can give you the best chance of diagnosing a stricture as being malignant, then this is a really good target for applying artificial intelligence, specifically a deep learning convolutional neural network, in order to improve detection, but more importantly, to improve interobserver variability and reliability of interpretation by having a machine learning algorithm to confirm a diagnosis that can, in theory, not only obtain a diagnosis of malignancy, but also provide consistency and limit any sort of bias that individuals may have and limit interobserver variability. At this point, I'll turn it over to my co-author, Dr. Neil Marya, who will discuss further details of our paper.
Hi, folks. My name is Neil Marya. I'm an assistant clinical professor of medicine at UMass Chan Medical School in Worcester, Massachusetts. Now, regarding the methods for this study, from 2012 to 2020, we looked at a retrospective database of all patients that had undergone cholangioscopy probe examinations during that time period and took all that cholangioscopy data. And in addition, from 2021 onwards, we identified all consecutive patients in 2 centers that had undergone cholangioscopy probe examinations for the evaluation of biliary strictures. Now, from that first cohort of patients from 2012 to 2020, patients were randomly assigned to either training or to testing subgroups. And from all patients who were identified from 2021 onwards from both centers, all patients were reserved for testing. Now, for initial CNN development, our machine learning engineer assigned us 20,000 cholangioscopy images to blindly annotate. Now, from this collection of images, we were totally blinded in that we had no idea what the underlying diagnosis was for those strictures or for those images rather. And when looking at those images, we were tasked with annotating those images as being high quality malignant, high quality benign, high quality suspicious, low quality, or uninformative. Now, once we trained and validated our convolutional neural network that was capable of mimicking those kinds of annotations, we then worked to develop a scheme or system using that convolutional neural network so that we could apply it to whole videos. And now I'm just going to be showing you an example of what it looks like when we apply our convolutional neural network to whole videos of both benign and malignant strictures. Now, once we had identified a system that worked optimally for the evaluation of whole videos of indeterminate biliary strictures, we then compared the diagnostic accuracy of the artificial intelligence system to that of traditional ERCP-based diagnostic techniques, such as brush cytology and forceps biopsy. And we identified that indeed the artificial intelligence had significantly greater diagnostic accuracy for the evaluation of biliary strictures when compared to those ERCP-based techniques. Now, our hope is that the promise demonstrated in this study will be further validated with larger multi-center prospective studies that will hopefully be coming to you soon. So I hope on behalf of my co-authors, I hope you enjoy our paper and yeah, enjoy.